Welcome to another episode of Woodstock on the Couch.
Thank you.
Coming to you live from our campaign office here at 867 Portage Avenue. I'm happy you're back.
Well,
Welcome
thank you.
back.
Thank you.
Welcome
Happy to be back.
Yes, I feel lonely without you.
Oh,
I feel like I'm missing something without you.
we're pretty well together 24/7.
Yes. Okay. But today, we want to talk to you today, the viewers, about an epidemic that is happening here in Winnipeg, Manitoba. And it's the meth epidemic. And we're going to go and talk to some folks on the street. We're going to go and talk to some individuals. We had a lovely conversation with Beverly Burkhardt.
Yes.
And you'll hear what she has to say and her experience in this. We also end up talking to Tom. We'd like to know him as Tom. And this is a young man who has gone through all of the various levels and layers of what the meth epidemic is. So he was a dealer, he was a user, he was everything you could think of. And you will get to hear him and hear his story today and see the impact it has on his life, his family, and others. Okay? And he actually went as close to near death. He had a near-death experience. He was hospitalized. He had only 30% of his heart valves working, 30-40%. And so he's currently now out, but he has to live for the rest of his life on about 20-30 medication and pills daily.
Wow.
That's the danger of what this meth is. But interestingly, you'll also hear from him with respect to what exactly got him there, and you'll get a chance to hear his experience firsthand with respect to the society and their views of him. Also, you'll get to hear firsthand with respect to all the various elements that surround him and how he actually coped from day to day and what his life is. And I think it's typical of most folks, and we're going to look at this in a two parts. So here we're going to be talking to him now, and for this exercise we'll name him as Tom, because we vow to carry his story and not him as a person being identified. So, ladies and gentlemen, without further, you'll hear now from Tom. You'll hear his story.
Like when I started using, I was smoking first, and then nobody come around and bubble or anything for a while, and then everybody talked me into doing shots. And then after I did that shot, I was done.
Okay.
I wasn't smoking anymore. I cut everything out just to get that high.
Just to get the high.
And then cutting all that out, like I used to smoke lots of weed, I used to drink. And after I started doing meth and shooting it and stuff, look, it changed. A whole new society out there in that group.
Okay.
And that group runs specific. They watch each other, they take care of each other, they help each other with drugs. And if somebody doesn't have it, somebody will come along and give it to that person that wants it. It's just like one big family.
Oh my God. So you're saying that there's almost an organized system out there for you to get this drug?
Like it's out there and everybody's doing it, and it's tearing families apart, and people are hurting each other, stealing from each other, and why?
Right.
And all they're doing is just putting chemicals in their body.
Yeah.
And I almost died a couple of weeks ago there. I ended up in a hospital and heart problems, and I had a little minor stroke last week, and all because of what? For meth? Putting my veins and ruining my veins, and why?
Right. So how easy was it for you to get the drugs?
And it was easy. Like I said, it's just like we all watch each other, we look after each other, we help each other. Somebody's sick and they need it, somebody will come along and that person will give it to them.
Give it to them. Oh,
And
wow.
say, here's your fix.
Oh, my.
And then once they get their fix, then that's it. And then they're not sick no more, then, you know, and then...
So some people view this as a way of medicating themselves, you think?
Yeah. It's just like anybody doing heroin. Like, I was on heroin too for a while. And I knocked out a doctor because he wouldn't help me. I was shaking like that, vibrating, and I wanted help. And the doctor refused to help me, and that pissed me off, so I knocked him out.
Okay.
Knocked him out, and on my way out, I told the front desk, I said, I didn't know what happened to the doctor. He fell off his chair doing the chicken. Somebody should check on him. I left.
Yeah.
And then the next doctor I went to see, he helped me. He gave me what I needed to get that ice, that, what you call it? Just getting that edge off.
Oh, the edge.
Killing
Okay.
the craving.
Okay.
And like I needed that med to help me cope with going through the withdrawals and stuff coming off the heroin and stuff, eh? And like the meth, like I've been clean going on a little over 3 weeks. I was in a hospital for 2 weeks.
Yes.
Right from hospital, I went to detox. I was there for 5 days.
Yes.
And then I was just realized what I was doing, what I was putting in my body.
Okay.
And that almost killed me. 20% of my heart was working.
Oh, wow.
My heart was leaking. My main valves to my heart was leaking, putting blood in my lungs, and I walk 6-7 feet and I'm huffing and puffing and
Wow.
stop, catch my breath, walk another 6-7 steps again, and then having a hard time breathing.
Wow.
And if I didn't go into hospital when I did, they would have found me somewhere in
Somewhere
the
in the
back
street,
lane.
in the back lane.
Yeah, and they would have found me there, and then what?
Then nobody.
What they're gonna do? Call it another OD?
Talk to me about solution. And what do you think the city can do based on what you have seen?
What they should do is like get people like that's been there and done it and drank and did all this stuff. Go into the high schools.
Okay.
Talk to the younger generation about what's going on, how they did this, how they did that, how they got this, how they get this, how they get their drugs. And maybe if we get some people coming and going out of these schools all in this city, maybe we'll open some eyes. Like I tried doing that a few places, and I talked to government people, office workers and everything. I told them, I said, I'll take a video camera, I'll go record what they're doing, what's going on.
Yeah.
But I won't record faces or names.
Okay. Names or whatever.
Names, you're gonna use names, use a street name or
yes.
yeah.
Yes.
Use something that's not your real name, you know?
Yeah.
And like seeing all this, like seeing these families getting torn apart and family hurting family for what?
Yeah.
It's for that next high. Why do you have to do that?
Wow.
And it's crazy. Like I seen a lot of shit. I did a lot of shit. I used to do 12 shots a day.
Oh my
Every
Lord.
hour on the hour, I'd stick a rig in my arm.
Oh my
For
God.
what? Just to get that high, so I don't feel the pain or whatever I'm going through.
Okay.
And it's just like, you know, when you're high, you forget what happened and you let it go, and then it's not generally, you never let it go because you never dealt with it the properly way.
Yeah.
If you're gonna deal with something, deal with it the right way.
Okay. And what way would you think this would be the right way to do it? Like, how did you? Because you
Like
look.
how I stopped was, I almost died.
Okay.
20% of my heart was working, and I was bleeding, lungs, blood going into my lungs, water going into my lungs.
Yeah.
All because of what? Meth. And that, I almost died.
No, man.
It was close, man.
Yeah.
If I didn't go in that day, guaranteed that night they probably would have found me somewhere laying in a back lane or something.
So it took a near-death experience for you to wake up and see that
It took almost me almost losing my life
wow.
to realize how bad it is and how it's affecting your body.
Wow.
And that I don't know if it scared me or if it fazed me or I don't know what to think about it.
Yeah.
And like I never talked to anybody about any of my problems before, and
Okay.
I was just doing the drugs just to cover the pain.
Just to cover the pain. So maybe if there was an outlet for you to speak to people more or get some kind of counseling.
Like what they need is like more counselors and more throwing it out there for helping people.
Yes.
That way they know the help is there and
yes.
not just going out there blind and there's a lot of people they don't know how to ask for help. Like me, I never liked asking for help.
Okay.
And coming close to dying there, that opened my eyes and ended up in hospital and ended up finding out about my heart, and only 20% of my heart was working. The main valves on my heart, there's nothing. There was no life in it. And just 20% of the one part of the valve that was working, that's what kept me here. And it opened my eyes and I realized I'm like, holy. I think about it, and the more I think about it, I'm like, oh, wow. Like, close, like, a little too close for comfort for that death experience. And if I didn't make it to the hospital at St. B or HSC, I would have been done.
You'd have been done.
They probably would have threw me in a bag last week or something if I didn't go. And it took a near-death experience to realize what kind of drug that is.
It is.
And
So
when you inject that, it's just like glass. As soon as it's in your vein, you get that little cough or whatever, you get that feeling, and that stuff hardens in your lungs and your heart, and it slows it down.
wow.
And it's like, it's all chemicals.
Chemical.
There's car fluid, acid, battery acid, and cleaning stuff, and it's all cleaning solutions. And if you don't know how to cook it up properly, or you don't know what you're doing, you could blow yourself up trying to make it.
Wow.
And it's unreal. And you see people talking to themselves, and they think they see something in the bush, and they think they see somebody sitting in the bush. There's nobody there.
Wow.
Wasn't that something?
That was
Wasn't
was very moving.
It was very moving. And to listen.
Very enlightening.
Very enlightening. Yes. And this is what this campaign is all about, is shedding light on the issue. This is what this campaign is all about. Speaking to folks on the ground. We need to start listening to the people who are actually on the ground. And when you listen to Beverly and listen to what she has encountered and listen to her experience being in the field, you can't help but wondering, why haven't the authorities listened to this kind of story or message or information coming from people who are on the front line?
Well, I think they have listened to it. There's lots of people who have lots of stories. It's just a matter of connecting the dots, of putting all of the right procedures and the right policies. And I think that's what we're going to look at, right? We're going to look at the different procedures and policies that are not connecting the dots, and so people falling between the cracks and things aren't getting done, right?
It's time for us to have a mayor who wants to talk to the people and get firsthand the information. You were sharing something with me about the meth crisis. Mm-hmm. Talk to me about that and what you have seen and with the meth.
Well, the meth crisis I started to see when I was running a housing facility, a dry absence-based housing facility a number of years ago. Specifically, I'm thinking about a young lady who had a mental health crisis that turned out to be a mental health crisis that was complicated by the meth use that she had been habitually undertaking over a great number of years. And so her schizophrenia was masked by this meth psychosis that she was in. And so rather than being able to actually get her into a program where she was able to receive some treatment to reduce or abate completely her meth use and then be able to deal with the mental health crisis, she was unable to access any services. She couldn't get into psychiatry because she had a meth addiction and a psychosis. She couldn't get her her help from her psychiatrist who had known her for years because he said it was simply a meth psychosis and refused to believe what the hospital was saying was actually a diagnosis of schizophrenia. And then, of course, because of the psychosis, she was unstable, she was volatile, she was violent, she was unpredictable, and then she would be encountering the police because of her behavior repeatedly, and then ended up just simply being in jail. And then it became a cycle. And what was really horrifying is that they would release her and she would have been stable and without meth use for a period of might be 3 months, it might be 4 months, depending on the cycle she was in. And then you would think that there would be hope to now be able to directly access the psychiatric help that she needed because she was clean, and because her psychiatrist refused to acknowledge the underlying mental health barrier that the hospital had diagnosed, she then couldn't access the treatment that she needed, and she would relapse into meth use. And she was so vulnerable because she couldn't be housed because of her volatile, violent, unpredictable behavior. And an individual who is in a meth psychosis, you're unable to actually, with them, negotiate or console or be able to in any way, shape, or form calm or abate their fears and their paranoia and substantially reduce their risk to others. And so they stay homeless and on the street.
So you saw this coming a week ago, a month ago, a year ago?
2015, I was in Hawaii.
Okay.
And I got a phone call on Christmas morning from HSC from a nurse in the emergency ward because she was back there again.
Okay.
Because I had advised my team of staff to call the police because the only thing that we could do for her in this state to keep her safe was to call police, and then they would take her to the hospital. So I spoke to the emergency nurse.
Yes.
Christmas morning from Hawaii, and explained to her that it was not okay to release this young lady back to the housing facility, although she was now at that point calm. I said she's only calm because she's not high. Okay. When you release her back into the community, she will use, and we will have the same problem we had last night, which precipitated the police bringing her in.
Wow.
So I said, you need to advise psychiatry that she has an underlying, undiagnosed schizophrenia that had been identified by a team of psychiatrists previously when she'd actually been in the hospital for an extended period. And so, of course, then it became, the nurse would go to the doctor would interview this young lady would present as calm and lucid, and so he would feel that she was in full control of her faculties. Really, at the end, what it was is she was exhausted from having been on meth for several days and was so calm from being so worn out that she presented as this calm, stable person. They released her, she goes home, she sleeps for a couple of days, and then the cycle starts back up again.
Wow.
So that was 2015 in December.
December.
Yes. So it had been the entire year of 2015 dealing with this young lady, and it went on for another couple of years. And the last I saw her, she was on the street, and it was December 20th, and it was when we had that bitterly cold winter a year ago, December. God. And I saw her walking down the street, and I pulled her in and got her hats and things like. I actually put 2 hats on her head because she had virtually nothing, and she was just floating because nobody would take her because of her past, and so she was just basically trying to survive. And I have no idea where she is, and we wonder why there's murdered and missing women because our facilities do not allow for people in this state, and they do not care for them when they are in this state of psychosis and when they are not in a state of psychosis, and we have an opportunity to reach them, grab them, and bring them in where it's safe and keep them safe. We don't do it because we have nothing for them.
I know very little about the Meth Crisis. Because I've never used meth before, so I don't understand it. The politicians and the bureaucrats knows very little about it, and that's why they look like a deer in a headlamp, and that's why they are somewhat almost clueless in some respect. The police is doing a fine job trying to cope and deal with the issue as it is and do the best they can. So this is not against the police in any way, shape, or form. What this is that I want to learn. I want to know from the people, and this is what we'll eventually capture, so that when we do sit at City Hall, we can make the decision that will bring about the changes that it needs to happen, because there has to be a change. Don't tell me that this has to go on forever. No. Don't tell me that we're going to move from 43% increase in the meth epidemic to now having it 80%. Don't tell me that, because I don't buy that. I don't buy that. There are solutions available to us. And part of it is hearing from the people themselves what they actually go through. Live their life for a moment. See what they see. And this is what this is about. Is not pointing fingers, because we're all in this together.
Yeah.
We're all in this together. At the end of the day, a life is a life. Yeah. Okay? And too often we see people strung out, and as a result of what? Oh, it's that person. Oh, it's that group. Oh, it's that individual. Oh, it's because of that. No, it's because we did not pay attention to the details that we need to pay attention to get the help to some of these folks as possible, as soon as possible, because prevention is better than cure. And thanks to others who have shared the story with us today. And so we will continue to do this, and hopefully we'll get the answer somewhere between working with, collaborating with, understanding the issue a little bit more, and learning from the people who are on the ground, who are seeing this for what it is. So, ladies and gentlemen, I want to thank you and thank my dear wife for joining us again on Woodstock on the Couch.
So this was the informational session.
Yes.
So this part 2 is going to be...
Part 2 of this is going to be all about solutions. So join us next Thursday. We are going to be providing an idea.
Ideas for a solution.
An idea for a solution. Yeah. And maybe we call it a Winnipeg solution. How about that? Yeah.
I like it, the Winnipeg solution.
So we're going to join us next week as we present an idea that could be possible the Winnipeg solution for the meth crisis in Winnipeg.
Yes.
I like that. I like that.
I like it. That would be great if, you know what, if these ideas could help to formulate a grand plan that will fix the meth crisis, then you know what? We got to do it, right?
We got to do it.
We got to do it.
We got to do it.
Got to do it.
So
let's keep talking.
Let's keep talking. Let's keep talking and let the conversation roll.
Yes.
So ladies and gentlemen, thank you for joining us for this week. Join us next week as we present this idea that could be, hopefully we'll follow this through, to be the Winnipeg solution for the meth crisis here in Winnipeg.
Yes.
Keep our streets safe and keep our young people safe as well.
Yeah, that would be great.
That would be awesome.
Yeah.
Thank you. Join us here next time, Woodstock on the Couch, saying, until then, peace.
Peace.